Social anxiety disorder. A great number of people suffered from social anxiety disorder, also commonly referred to as social phobia. These individuals experience something like panic attacks, extreme self-consciousness, and phobias that leave them unable to stop worrying. This goes far beyond normal fears and worries and is a crippling disorder that leaves them almost incapable of functioning normally. Fortunately, there is absolutely no reason that anyone has to deal with this troubling problem any longer. There are a variety of ways to treat this fear and anxiety. Also, for those who desire to seek treatment that does not involve medication, there are a number of treatments involving therapy instead. These are wonderful options for those who wish to stay away from drug interventions for this condition. Research has shown that cognitive behavioral therapy and exposure therapy are the most effective methods of treatment. Both help to ease the symptoms of social anxiety disorder and will also help individuals to get to the bottom of a problem by discovering and dealing with whatever is the cause of the disorder. First of all, cognitive behavioral is an effective treatment option for social anxiety disorder. It is used frequently to treat a variety of phobias and other anxiety disorders. Various components are used to try and get individuals to release negative patterns of thought, including the way that they look at themselves. It helps people to examine the way that they think and the way that they behave in certain situations, especially those that cause excessive stress or anxiety. There are 3 basic steps involved in cognitive behavioral therapy. First of all, people must identify their negative ways of thinking. During this phase, people consider the events that trigger anxiety attacks and try to determine what exactly about the situation makes them so nervous. Secondly, individuals need to question the rationale behind the anxiety. If it is not legitimate fear, it is important to consider alternatives that may help the people to deal with it. Finally, individuals need to learn to replace these negative thoughts with more positive ways of thinking. It is important to affirm one's importance and ability to act appropriately. Exposure therapy involves actually becoming involved in the situations that bring about anxiety. Some believe that having to deal with them, and examining behaviors that occur when dealing with those situations will force individuals to learn how to handle them without becoming overly anxious. Some find that practicing relaxation skills during this time will help them to learn to make it through such experiences with minimal panic disorder troubles. Additionally, many of them use these experiences to create a step-by-step plan for dealing with such moments. Social anxiety disorder is a real problem that affects many individuals on a daily basis. It does not, however, have to continue to be a crippling problem. Natural remedies, including therapy, can be used to help individuals learn to deal with life as it comes.